My name is Hussam Hawamdeh. I'm the structural cardiologist at Baptist Health Fort Smith, and I'm the medical director of structural cardiology. ECMO is considered one of the most aggressive forms of what we call mechanical support devices. It's a device that pretty much equates to a portable heart-lung bypass machine. So the patient is completely dependent in terms of having the blood oxygenated and having the blood circulating in their body on this machine. And this helps provide some rest for the heart and the lungs, especially when they are not working as needed. So we start patients on the heart-lung bypass in here with the goal of getting them to our main campus in Little Rock, where they have a dedicated unit for this kind of patients with this kind of mechanical support. So we look at ECMO in multiple different scenarios. One of them is sometimes patients come in with what we call a massive pulmonary embolism, which is a blood clot that went to the lungs and there's no more blood flow to the lungs. We look to ECMO in patients who have sudden failure of one of their heart valves. Either the valve is too tight, the valve is too narrow, or the valve just tore apart and is not performing the function, where fluids are backing up to the lungs and they can no longer breathe on their own. We look to ECMO in some cases of trauma where the lungs gets filled with blood and patients are not able to oxygenate. It's not necessarily a bleeding in the lungs, it's more of a bruising in the lungs where we have to help the lungs rest and recover. We've used ECMO a lot in terms of COVID when the lungs were not able to oxygenate. We also look at ECMO in people who their heart function is not working okay. And for some reason or the other, they either had a heart attack or their just disease naturally progressed and got worse. Then we put them on ECMO in hopes that either we get their heart to recover from that event or we can bridge them to a more durable form of mechanical support. You know, the question sometimes comes up, well, if they are going to Baptist Little Rock anyway, why do we need to start the process here? And the main reason is once we identify that a patient needs ECMO, time is the enemy. So the longer time it takes us to get somebody on heart-lung support, the more damage is going to happen to otherwise healthy organs that will work against them in terms of recovery and being able to resume their life afterwards. So by being able to offer ECMO support here, we're on average decreasing that wait time by 3 hours, which most of the time that means the difference between life and death. It not only offers us a life-saving measure, it also elevates the level of care that we can provide. There's a lot of procedures or a lot of medications that we would like to use that previously we could not use because there's rare side effects. It's still a possibility that the heart may stop completely or the lungs may shut down. And having ECMO here locally means that we can offer more advanced or more comprehensive treatment to our patients, knowing that we have a safety net and we have a safe way to deliver this care.